The Dr. James and Nurse Alice show. It's Monday, and we go in live. Since we don't have a theme song yet, I'm gonna just sing my own song,
Right.
theme song. Right. I am Dr. James Simmons, very proud nurse practitioner. This is America's favorite nurse, Alice Benjamin. Yes. Hey, so we are going to talk about Ozempic, Oprah, and the weight loss medication revolution. Because, as y'all know, Miss Oprah has this whole special that just came out on Hulu, and it's causing a lot. I don't know if is controversy the right word.
It's definitely causing a lot of talk, a lot of discussion, and I think it's actually some polarizing discussion. You got some people all the way over here, some people all the way over here, and we're just trying to find a nice, safe middle ground because, you know, obesity is a health condition that can have a lot of negative effects, and we want people to be as happy and healthy as possible.
It is true. Happy and healthy as possible is correct. And so a little bit of housekeeping. So you can kind of see me, y'all can see me looking away. I'm trying to go live on Instagram right now, but it's not working. We are using Restream, and Alice and I are maybe not the most tech savvy people on earth.
Yeah, not with this. Ask me something else. Ask me about a balloon pump, a ventilator, something like that. I got you. I got you.
With all of that, I am good. So we're trying to go live on Instagram while we're doing this, but I know right now we are actually live on YouTube, LinkedIn, and X. And so for those of you who are watching this live, we appreciate y'all coming in. We got some folks watching. We want to know what y'all think about Oprah, Ozempic, all the weight loss medications, and this sort of weight loss revolution that's going on. So hit us up in the comments. We're going to try to get everybody's comments from all of the different platforms and answer your questions. Today is a short live. We're just going to do a quick half an hour.
That's what we say. Yes. But this is a hot topic. Definitely something, James, that I can personally relate to. Now, obviously, and, you know, I've had children. Most of it was from childbirth. I'll say there was a point in time where I was struggling to get a pair of size 16, 18 pants on. I'm talking about, you know, you jump, and hopefully I'm going to squeeze into the pants like that. And, you know, I was definitely overweight. I didn't like the number on the scale. I didn't like how I felt in my skin. I was going to my doctor at the time, and I was teeter-tottering that fence with high cholesterol, pre-diabetes, all this stuff. And I definitely had to make some changes. And while everyone's change is going to look a little different, I was able to do it and get back down to, I think I was like 190 at the time. And then I was able to get down, the lowest I got to was a 135.
Wow.
I know.
How did you do that? Like what was the thing?
Well, the one thing, a few things was going on. So just as encountering obesity, we know the physical part of it. So the physical part of it, I was really big, but part of that was because I was eating foods all the time. I believe I had some depression. Hindsight's always 20/20. I had some depression going on. I didn't have a structured schedule. I was home a lot. I was eating a lot of fast food. I drink a lot of soda. I love Coca-Cola soda, just to let y'all know. And so I was drinking pop like 3-4 cans a day at least.
Wow.
But you know what? A big gulp is about that too. So I'm just saying. But I was, you know, all that, and I wasn't exercising. I wasn't sleeping well. So a lot of things. That's what I was dealing with. And so I just made small little incremental changes. And then I started to see the weight drop a little bit. And I said, oh, okay, I like this. And then I started exercising. But I'll be honest, I did not incorporate exercise initially. That's harder to do. You already eat. It's easier to change something you're already doing versus instituting something that's all brand new. So like exercising was not my first go-to.
Right. Well, and because there are so many people, and listen, I'm just going to say, by the way, we just got live. We're live on Instagram right now. So some folks are joining. So now, because we're a few minutes late on Instagram, I'm going to just say again, really quick, welcome to the Dr. James and Nurse Alice show, live Mondays at 5 p.m. I'm Dr. James Simmons. That is America's favorite nurse, Alice Benjamin. And today we are talking about Oprah, Ozempic, and the weight loss medication revolution. No, we're not being paid by anybody to talk about this, but it is a very hot topic. It is a very controversial thing for some people. And we kind of want to have like an informed medical and nursing conversation about it from our own experiences about weight, which is what Alice was just sharing, as well as we want to know what y'all are thinking. So by the way, we're going live using Restream. We're a little bit new at this. So we are technically live on YouTube, LinkedIn, Facebook, and Instagram right now. Please give us your comments. We will answer your questions. We're going live until 5:30 on the nose today. We want to know y'all's thoughts about it. Did you watch the Oprah special? What do you think about these medications? We'll answer questions that you have. So that being said, Alice was sharing with us her experience about, this was post childbirth, having weight, excess weight that you didn't want on your body. And what you did to sort of get back into a body that you were more comfortable with. Yes,
but I'll be honest, I didn't get there until the point where I was at my annual appointment, and my doctor was like, wait a minute, like you're really teeter-tottering the line here. I was gonna have to start some medications and do all these other things. But and with many providers, I mean, I guess depending where you fall, they'll say, okay, let's try some lifestyle changes, change our activities, exercise, let's get some therapy before we start you on medications. So I didn't want to take any medications. Not taking medications, nothing's wrong with them, but I initially wanted to give this a fair shot with lifestyle changes, because by far, diet and exercise are the first two things that we should be prescribing to anyone, right? When it comes to being healthy, the most natural way, because everyone say, oh, I want to do this the most natural way. And so that's what I did. So, but also I have to say, then Jen, part of that was therapy. There was some therapy in there because there's definitely a mindset that comes along with weight loss. It's like, I don't know what comes first, the depression or the depression or the weight gain, or did the weight gain come first and the depression came? I don't know, but they were two tied together. Right. And so I did a little bit of all of that, therapy, changing what I ate, exercising a little bit more eventually. But I'll be honest, I started with Burger King. So I love Burger King, y'all. Sorry. I would go to Burger King. And then I just said, instead of the Whopper, can I have the Whopper Jr.? No sauces, no cheese.
Wait, but Alice, hold on a second. Hold up. I gotta interrupt you. I gotta interrupt you about Burger King right quick. So first of all, we have some questions coming in about how long people need to stay on Ozempic, Ribelsis, things like that. So I'm gonna get to your questions, I promise. But Alice,
are you ready know about Burger King?
What y'all know about Burger King? First of all, Alice, this was me back in the day. Okay, so a lot of people don't realize at one point in time I was 315 pounds. Right now, I'm rocking a cool 230 right now. I've been as small, I guess is the right word, as 180.
Okay.
Which on my frame is very, very thin. So, but my Burger King go-to order, Alice, was the chicken sandwich, biggie sized or whatever, right? With an extra rodeo cheeseburger or two. Or two. Sometimes I would eat 3 sandwiches from Burger King at a time.
Yeah.
And that would be like dinner every night.
Yeah. See, I did the same thing. Well, different order, but Whoppers are my thing. I love a good Whopper. But okay, so the reason why we're talking about this, guys, is because it seems like Dr. James and I both had a time in life when we were overweight, obese, and just weighed more than not only what we wanted to, but what was healthy for us. That was unhealthy weight for us. And so we made changes. Now, James, I shared what I did. What did you do to make your changes?
So what did I do? Well, there's a couple of things I want to acknowledge, first of all, too. Like we're probably going to use and continue to use for the next 20 minutes or so, this word obesity. And I know in a lot of circles and a lot of communities, this is kind of a dirty word. That's kind of a tough word. So, there's a lot of stigma that comes along with that word. And so I really want to take away from that. I personally tend to use the word fat almost as a reclaiming of that word. Like I'm a fat person, like I live in a fat body. And so I don't have necessarily shame and stigma around that, but I understand lots of people do. I understand that obesity is a difficult word as well. So sometimes you might hear us say obesity. You might also hear us say like people who have excess adipose tissue, which is fat that may or may not be causing health issues for you. Okay. That's kind of how we are this conversation. The time I lost a sick kid my whole life, dealt with all of that, got to college, lost a little bit of weight when I was playing sports, and then gained it all back when I stopped playing sports, plus some. And like I said, I graduated college at 315 pounds. And that was right around the time of Atkins, when Atkins was like a huge thing. Yeah. So speaking of Burger King, Alice, sometimes I would just go to Burger King and order like 4 cheeseburgers and then just eat the meat on the inside of the patty. Now, that's not the healthiest diet on earth, but I tell you what, Alice, I lost like 85 pounds in a year. I probably didn't touch a carb for 10 months. Like I was living on chicken breast, Diet Coke, and cigarettes because I still smoked at the time.
So, okay.
I got skinny, but I also was like gray. Like my skin was all nasty and gross. I was like melting. Like I had like no. What's that?
Not that I want you to be doing all like this, but you bring up a good point about weight loss, and maybe it wasn't the healthiest weight loss, but you lost weight. So I think right now in today's world, people are trying to lose the weight, whether it's a healthy way, safe way, or not. So like we've seen people starve themselves. We've seen people, they try different diets, and people ask me, what do I think about different fad diets? Now, for the most part, I will say, I'll look at them like, okay, jumpstart the weight loss, but perhaps this is not the diet or the nutrition that you will, is sustainable over a long time, because you want to, your body needs proper energy, minerals, vitamins, nutrients, the proteins, and all of that stuff to function healthy. But let's talk about weight loss and doing it the healthy way. Because you said you looked ashen. Well, I mean, you didn't seem like you lost some weight, but maybe it wasn't the healthiest way to lose weight.
And no, it was a terrible, a 2 liter of Diet Coke, half a pack of cigarettes, and a chicken breast a day. Sure enough, baby, you're going to lose a gang of weight. But that was not healthy. But I think what's really important about this conversation, and we want y'all to chime in. There are some comments coming, so I'm going to get to these comments in just a second. But I think one of the things that's most important about this conversation is that there has always been this sort of other aspect that has been missing in terms of helping people get to a calorie deficit, if that's what's required, to lose fat. And again, fat people are not inherently bad. Being fat is not inherently bad. And not all fat people have health conditions related to their fatness. Those of us who do, like my high blood pressure, my high cholesterol, all of those things, it was important for me to lose weight. And so I've always been an athlete to some degree in my life. So I could just sort of exercise a little bit extra and I would lose some weight, Alice. And I'm actually okay at kind of not eating very often. So like intermittent fasting types of things have kind of worked for me periodically throughout my life. But there was always this other factor that I couldn't just figure out, right? Like a lot of people. And this is where what we're learning in the research about these medications, these GLP-1 agonists that have been around arguably 15 to 20 years, is this hormonal component, is this brain chemistry component that is just missing. And so we have some people in the comments here, Alice, who are talking about, people who they're sort of upset that people are saying that it's maybe just for diabetes. And I think it's a really important clarification and distinction for people to understand that these medications are now approved, some of them, for, of course, type 2 diabetes, which is what they were originally designed for. But then there are also some that are also approved for weight loss in people who want to take it and who may have health conditions related to having excess adipose tissue, excess fat on their body.
Yes. And let me say this. So I'm glad they were saying, so these medications are now FDA approved for indications of diabetes as well as weight loss. That is different from whether your insurance will approve for payment. So let me just be clear, because I got a lot of patients that ask me, because they'll say, oh, the pharmacy wants you to submit a prior authorizations. Boo, I'm going to submit it, but it ain't going to get approved. So ask the pharmacist for a coupon, because no insurance across the board in the United States is paying for weight loss injectables via insurance. They're just not doing it. I know it's FDA approved indication, but that doesn't mean your insurance is going to pay for it. So I think that's a very important factor that. But also, James, this hope comes at a very hefty cost. Let's be honest. I mean, even with a coupon right now, I think you can probably get your weight loss injectable for roughly around $500, $600. Without a coupon, you're going to be paying $1,000 a month for 4 once a week for a month. So that's $1,000. So yes, we want the weight loss because it's the healthier thing to do. It's because not just the weight loss so you look good, but that's going to hopefully bring down your, blood pressure, blood sugar, cholesterol, a whole bunch of other things that come with that, right? But it's such a hefty price and insurance is not covering it. So how are people who really need it or could benefit from it, whether short-term or long-term, how are they going to get it if it's not affordable? And let's not talk about the shortage right now. Let's not talk about the shortage.
No. Let's talk about the shortage because somebody brought this up as a comment on Instagram. Somebody brought up the shortage. So listen, this might make me a little controversial. Y'all might try to cancel me. I threw this out last week's show, Alice, about how it's like everybody trying to cancel me about X, Y, and Z. But here's the thing. Celebrities being on Ozempic or Mounjaro or any of these other medications are not the reason some people can't get it for their type 2 diabetes. The 2,300 celebrities that are on this medication are not the reason that the millions of people who need this medication can't get it, okay? Just think about the math. This is a supply and demand issue. This is capitalism. This is the drug companies not being prepared for the overwhelming demand of this, thereby not being able to fulfill the supply. And frankly, it behooves them to have a supply demand curve that encourages people wanting this medication more, there being a shortage of it, and they can continue to charge these prices that they're going to charge for the medications. So I do not buy into the narrative that, sure, there are probably some people who are on these medications who maybe shouldn't be, right? They actually don't have a BMI that would qualify, although we know BMI is crap. But they're thin. They're on the medications to lose 10 pounds. Yes, that's some of it, but that's not 90% of what's going on here. So I want to be explicitly clear about that. I do also think that the shortages are starting to ease to some degree. But Alice, to your point, because now with the coupons, the medications, the cheapest you can get them are $400 or $500 usually.
Yes. And also let me say this, because these are medications that you increase the dosage. So I feel like I want to call some of their headquarters. What doses are y'all manufacturing? Because it seems like everybody can get on it. But the minute you start going up, I'll take Mounjaro, for example, 2.5, 5. Once you get to 7.5 and 10, those are like the hardest doses to get a hold of. It's almost like and I would hope Big Pharma's not doing this, but selectively deciding which doses we're going to make and put out there. Like we're going to make a whole bunch of the entry doses so everybody can get on. Everybody's going to love it. They're going to be hooked. And then when they get up to the higher doses, it's hard to find. I have patients who are literally asking me, can I switch over to Wegovy, or can I switch, they want to change their medications, but the truth is there's a shortage of all of them. And it's really kind of those mid or higher level doses that seem to be more of a shortage. But it also could mean that there's so many people who've started it that there's a larger group that are at higher doses. I don't know, but I wonder, and let me also put something out there. This is more of a question. I don't know the answer. James, let me if you want to. I'm going to use Mounjaro, for example. Mounjaro, indicated for diabetes. Zepbound, indicated for weight loss. But it's the same thing, just wrapped up different. I know those got to be made at the same warehouse. So how do they decide which is going to be which? Because I've always seen a shortage. I'm seeing a shortage in people who are asking for it for weight loss indications. I've not had anyone with diabetes say, "Oh, I can't get a hold of my insulin." So how are they selectively choosing, like which ones? How much to make for diabetes and how much to make for obesity? Do you know?
That's a really excellent question. No, I don't know. And I do have some supply chain experience when I worked at PepsiCo, like for Quaker Oats and Gatorade, that division in the supply chain division. So I have some idea about how supply chain stuff works. I did that job for years, but I don't know. But maybe, you know what, we should have a representative from the drug company on to talk about this. You know, I will. Speaking of sort of Oprah, you know, Oprah had this special, and we haven't had a chance to really dive into it yet. And we have 9 more minutes to then today's show, and I still want to get to y'all's questions. But she did have a couple of folks on from Eli Lilly and Novo Nordisk, the 2 drug companies who you know, make the medications. They were very political in their responses, right? They didn't really dive into too much or whatever. And I thought that was, I mean, good on them to be political in their responses. Like, you know, that's their thing. But Alice, because we have a couple of questions and I want us to be able to
they're about the medication.
Yeah. They're so we have Ronaldo saying, I think that's on Facebook, insurance is covering hers, which is fantastic. Higher doses have actually been easier for her to get. I know, right? Shoot, Ronaldo,
where do you live? Because I need to send patients over to
right, you got that mom insurance, girl.
That's what pharmacy? Because listen,
right, all of that. There's I do have one question. So this is one of the most controversial topics. Someone on Instagram posted or asked a question that they said that once you are on Ozempic, you must take it for the rest of your life. So I have my very, very strong opinions and thoughts about medications for the rest of your life, whether they are related to diabetes or weight loss or blood pressure or anything else. But Alice, I want to know your thoughts about this.
Yeah, because this is what I'm gonna tell you if you're my patient. I'm going to say, first off, before we get on it, I think it's important to talk about a plan, because hopefully you don't need to be on that type of medication for a lifelong, because it really is meant to be an adjunct to a larger plan: diet, exercise, sleep, therapy, things like that, because there are a lot of other factors that play a role in this when it comes to weight loss. So when patients ask me, will I need to take this lifelong? My answer to that is I hope not. I hope we're able to jumpstart your weight loss, get some healthy habits going, and get you to a point where you can come off the medication and, maintain those healthy habits without it. Now, some people say, but I don't want to gain the weight back, because there are studies that show once you've been on the weight for a while, you're likely to gain, I think, was it about 20% of the weight back after you stop taking the medication.
Even more so. Yeah. Some people gain as much as 80-90% of it back.
But you know why? Well, I won't say this with 100%, but part of the reason why I believe that is because not only do you no longer have that medication there, which is kind of suppressing your appetite in a sense and kind of slowing food moving throughout your digestive system, so you have that feeling of satiety. But if you've not changed your mindset, you're still going to be eating the same way, doing the same habits that are going to increase your chances of gaining weight. That, I believe, that definitely contributes to the weight gain after you come off the medication. And some people, let me say this, James, there's some people who I'm like, well, you need to come off of it. They're like, well, no, it's okay, because they're having nausea, a lot of GI upset and issues, and they're feeling miserable. Mm-hmm. And they're asking me for medications to anti the symptoms. And I'm like, well, really, we could try that for a short term, but if this is how it is, then you really might want to consider coming off of it. And they do not want to hear that. I'm going to get canceled. I'm going to get fired as a provider almost, because they don't want to hear that. They're like, just give me some Zofran. Just give me the Zofran, lady. That's what they want. That's what they say.
Right.
That's exactly what they say to me.
That's so funny. I mean, they're like, I'll deal with the nausea, right? Well, yes. It speaks to, and listen, it speaks to how, oh my gosh, because this could be a 14-hour-long TV show. And there are podcasts. If y'all don't listen to Maintenance Phase, it's a great podcast. Although they haven't put out episodes in a couple months, but Maintenance Phase is a great podcast. What's that?
So is the Ask Nurse Alice podcast.
So is the Ask Nurse Alice podcast. I'm getting there. But Maintenance Phase is very specifically focused on on those of us in fat bodies and sort of the healthcare institution, how we manage things like that. But one of the things that I think it is really important. So Alice, this is one of the good things you get about the Dr. James and Nurse Alice shows, because we don't always agree. I'm going to disagree with Alice a little bit here, because I think that there is a mindset about chronic medications that needs to change. So this just You just need to eat less and exercise more. You just need to fix your willpower. And if you could do that, you'll lose a bunch of weight and you'll keep it off for forever. So if that was the case, that was honestly the case, we wouldn't have 60% of adults in the United States overweight, or at least obese, or at least overweight. You cannot tell me that 150 million Americans, you cannot tell me that 1 billion people in the whole world who are obese, we all have terrible willpower. We all, none of us can't eat right and exercise. And so this third component of keeping the calories low, calories in, calories out, because that's arguable as to whether or not it all comes down to that. But for conversation's sake, if it comes down to calories in, calories out, there's this other component that has been missing. And the food industrial complex is all screwed up. What we put in our bodies is terrible. That's contributing to a lot of this. But until those things get fixed, just like my blood pressure, it is a medical condition. And so I've been on blood pressure medication since I was 17. And baby, when I take my blood pressure medications, I'm good. We're like 120s over 70s. Great. When I'm off those medications, I'm like 170s over hundreds. Like it's bad. Fat or thin, it didn't matter. And so I wake up in the morning, I pop my pills, I brush my teeth, I pee, I go about my day. And so if that's the attitude that I think that people should embrace, if they are individuals who may need or want to take these medications, particularly if them having excess adipose tissue, living in a fat body is causing health concerns, cool. So you got to stab yourself once a week, going about your life.
I agree with much of what you said, and you're right. The food industry has definitely played a role. And we got to fix that because they're actually engineering and designing food in a way that stimulates our dopamine receptors in our mind, in our brain. So we're craving those foods, right? So there's that part that needs to be fixed. But I'll say this, and you brought up a good point. If this is something that's kind of, I forget exactly how you said it, but medically indicate, like when you don't take your blood pressure medications, your blood pressure goes up, risk for heart attack, stroke, all those other things. I don't have a problem with that. I don't think there's any issue with long-term medication use of this medication. But if you're only doing it to look like to fit into a dress, like to me, the medical indications for that are not there. And the actual risk can outweigh the benefits, especially if you're having GI issues. You can have GI, what's it called? Paralysis. You can develop cancers. Like there are other things where I think you need to look at the benefits, the risks and the benefits of the medication. And so yes, medically indicated, if that weight is causing you issues, it's medically necessary. Yes, you need to take that. But if it's just because you want to fit into a size 2 dress, because that's what you were in high school, and now 40 years later, go take the dress to get altered.
She said, get the dress altered. And listen, this is again, I wrestle with this. I think that's one of the things that's really good about the Dr. James and Nurse Alice show is we don't know. It's not always about, listen, y'all, I tell people all the time, medicine and nursing is much more of an art than a science. Like sometimes things are gonna be gray. Sometimes multiple truths are going to exist. And that's just the damn truth. So I do wrestle with that because I don't want to hate on a person for wanting to feel like they want to look and be in a certain way in their body. But to your point, Alice, which is so beautiful, the risks of these medications might not be, I mean, they don't come without risk. They certainly don't come without side effects. So it might not be worth it. And what does that also say about our society at large, that like you are willing to like pay $500-$600 a month and maybe have the risks that are associated with these medications, although very small, but you might have the risks associated with these medications for you to lose 6.5 pounds so you can fit in that dress. Like, I don't, I think that's something we need to sort of reconcile sort of as like as a humanity, as a species, as a culture, particularly in Western culture in general,
Yes, I definitely agree. And so, and I know we're coming up on time and there's so much more to unpack with this topic, but I mean, the takeaway, James, I think the takeaway is, well, we really wanted to kind of introduce the conversation, especially since Oprah came out. A lot of y'all saw her ambassador for Weight Watchers. Then she talks about, she was taking medication. And then some of you are like, wait a minute, what's going on? We've been bamboozled this whole time. But the truth is, there are multiple things that probably need to be done in order for someone to have healthy, safe weight loss. And I think, and that's why Weight Watchers is now partnering with some of the weight loss companies, because they recognize that, yes, this medication can help you. It's an adjunct, but we also need to make sure that you're still eating healthy. We cannot leave that behind, guys. Eating healthy and exercise. And I know, mind you, some of us, arthritis kicks in, back's bad, joints, you just can't exercise the way you used to. And it gets a little more challenging, right? But we don't want to lose sight of those things, because those things are definitely a complement to taking those medications.
They most certainly are a complement to taking those medications. Listen, I think that this might have to be another conversation that maybe we pick it up on next week, because there are certainly some folks who have chimed in. I get DMs about this a lot. I get text messages from friends and family, emails, websites about this very often. So I think this is certainly a topic that we can and will continue to talk about. So I just want to, listen, if you are watching this on Nurse Alice Benjamin's platforms, don't forget to set those reminders that we go live every week, Mondays at 5 p.m. And then also come on over to my platforms and follow at Ask the MP. And if you are watching on any of the at Ask the MPs, because right now we're on YouTube, LinkedIn, Facebook, Instagrams.
Yes.
Soon to be TikTok next week, I think. Go on and follow Ask Nurse Alice. All right. Because we're going to do this every week. And most importantly, this is about engaging with y'all. This is about getting to those comments. This is about having a conversation with y'all and really addressing the health topics that you want to talk about in a fun, approachable, but evidence-based and scientific kind of way at the same time.
And if I may add, I know you, James, just mentioned our handles on which you can follow us. But in addition to follow us, if you could share, sign up for our newsletters, go to our websites, but, let the algorithm, let the internet know that this is content that you want to hear about. So that way it can kind of get us in I don't know what that algorithm is, top secret, but get us up there so we can be out there to the masses and educate and share all this information and present different perspectives on several of the many important health issues that are out there, because we want to talk to people before they become our patients. And so this is a healthy and safe space to do so. So I'm so glad that I get to be on here with Dr. James.
Wait, I'm super happy to be here with you, Alice. I'm also super happy that you better stop dropping these dimes on us talking about, we want to talk to you before you become our patient.
Yes, that's my mantra. I want to talk to people before you become my patients. Yes, because listen, in the ER and the ICU, James, where they see us, that's a whole nother conversation. The insult, the injury, the sickness, the illness, the problem has already happened. So we want to swing that pendulum, talk to y'all to help y'all stay out of those hospital areas as much as possible. Yep.
I love it. We're gonna keep you out of there. All right, that is our little mini show for today. Next Monday, 5 p.m., we're going live. In the meantime, a bunch of social media content coming out. Follow us here. Set those reminders. DM us your questions or email us or whatever, because we want to talk about what you want to talk about. And we are so grateful for y'all being on this health journey with us. And we will see y'all next week.